Great. Thanks, Holly. Thanks, Heidi. Next, I'd like to introduce Tom Roick and Carol Trenga. Tom's the Air Quality Monitoring Manager, 30-year veteran of the Oregon DEQ. His team works out of the laboratory in Hillsboro. I mistakenly said Portland yesterday. Sorry about that. And maintains a network of over 70 air quality monitoring locations around the state, collecting criteria, pollutant, air toxics, and of course, wildfire smoke information statewide. Carol Trenga works with the Oregon Health Authority in the Environmental Public Health section. She provides subject matter expertise for the development of public health policy and program evaluation, analyses of human impact or health impacts of environmental pollutants and climate change. Carol's interests include applying environmental epidemiology to help identify disproportionate impacts, inform risk communication, and community-based decision-making and interventions. Great. Thanks, Tom. Thanks, Carol.
All right, thank you, Jim, and good morning, everyone. So I'm going to focus on DEQ's expansion of our PM2.5 air monitoring network with wildfire specifically in mind. And then Carol's going to come up and talk about using that PM2.5 information to do exposure assessment and look at health effects from that. There we go. So forecasting for poor air quality and issuing air advisories is a big part of what we do. We have an interagency group of folks that get together during wildfire season, and we evaluate both weather conditions and wildfire conditions and put that together and decide if we should issue an advisory for poor air quality in different parts of the state. So the more lead time we can do, the better forecasting we are and the more lead time we can have, the better off those local agencies are, like the folks in Oak Ridge, and they can get out in front of that and take actions to protect people's health. But it all starts here with the Air Quality Index. So this is the main tool that we have for sharing air quality information across the state. So it's a map of the state of Oregon with all of our air quality monitoring locations on the state. It provides PM2.5 as well as the color-coded air quality index, which is based on health effects at different levels. And this is my shameless plug for the Oregon Air app. So we do have an app for the AQI. You can download that on your phone and absolutely free have air quality information at your fingertips. So to expand our network of air quality monitoring locations, we actually developed our own in-house PM2.5 monitoring sensor equipment. We call it the Sense-Or, or the Sensor Oregon. What this is allowing us to do is at lower cost, expand our network. We have more locations across the state, but it's giving us, at DEQ, the data quality objectives that we need to actually share information with the public as a state agency. And we're trying to account for conditions like this. And what I'll point out is September 2020 wildfires, I think a lot of you folks have probably seen this, is how much the coastal areas were impacted by smoke during these events. From a DEQ perspective, air quality is actually really good on the coast most of the year and most days of the year. So there really isn't a need to do air quality monitoring along the coast, with the exception of wildfire. So that's just one example of why we're expanding our network with wildfire smoke in mind. So looking back to 2017, each dot is a air monitoring location for PM2.5 across the state. At that time, a couple of the drivers, and historically the drivers for our network, is population density. So where are people living that are impacted by poor air quality? Portland metro area and the larger cities along the I-5 corridor. And the other driver is wintertime conditions, when we have stagnant air events and smoke from burning wood to heat homes accumulates in some of those communities. So Klamath Falls, Lakeview, Burns, Oak Ridge, and others. So we've expanded the network. Here we are in 2022. So we actually had about a little over 30 PM2.5 air quality monitoring locations around the state back in 2017. And we've actually doubled the size of the network now. We have over 70 locations across the state. And you can see in 2022 here we have 5 locations along the coast now that we didn't have previously. We expanded all the way out to Ontario, the far east side of the state, and some other locations in the Willamette Valley. And in the last full legislative session, we received resources to actually expand our network again with an additional 20 locations around the state. So we have proposed locations for expanding the network, and we have a survey out right now to get public input on where we should go. But there is an overriding question about where should we be going next when we expand our network. Are there parts of the state that we're actually underserved in terms of DEQ's monitoring network with environmental justice in mind in particular? So we embarked on what we're calling the Polygon Project. We're actually looking at the spatial coverage of every one of our air monitors across the state. How well are they covering the state? And we're calling this the Polygon Project because we're basically ascribing airsheds to the air monitorings we have at those locations. And this is, again, helping us look at the state and where we can go next in terms of expanding our air monitoring network. We collaborated with the Oregon Health Authority on this project, and we very much appreciate our collaboration with OHA. So the DEQ side of this is where do we want to expand our network, and the OHA side of this will be looking at health estimates, and I'll hand it over to Carol for that.
Carol. Take that off your hands. Sure. Okay. Great. All right, thank you, Tom. And I'd like to thank the organizers for inviting OHA to participate. And I also want to acknowledge colleagues, Tori Clemens and Eric Main at OHA for putting a lot of effort into this project. And also Aaron Fellows, I'm going backwards, sorry about that, at DEQ. For a lot of technical assistance with the Polygon project. So today I'll be talking about applying airshed data from DEQ's Polygon project to improve PM 2.5 exposure estimates for wildfire smoke impacts on health in Oregon. So this set of maps gives you an idea. We're still refining some of the Polygon data, but these maps show admissions to hospitals from 2016 to 2020 aggregated, and these are rates per 10,000 residents. So the map on the left is hospital admissions. The map on the right is emergency department visits, and these are for an entire calendar year, so all those years complete, for people who had respiratory, cardiovascular, or cerebrovascular conditions. So this gives us an idea of what's the burden of illness in the communities by airshed. So it was a little tricky to estimate populations by airshed because they don't conform to regular boundaries. But thanks to some good demographic and geospatial expertise, we were able to do that. And we see a wide range of rates in these different airsheds, from 128 to over 1,000 hospitalizations per 10,000, and then from about 196 to over 3,000 emergency department visits per 10,000. So those are some of the considerations that we're bringing into conversations with DEQ about monitor placement. And this is just kind of a high-level overview of the data we have. We also have underlying information on demographics to address the EJ concerns and disproportionate impacts. So a continuation of the work with the Polygon project is to enable us to create exposure estimates from monitored PM 2.5. So part of that project was to overlay a 4x4 grid on the whole state of Oregon, so 4x4 kilometer grid. And we're applying scaling factors based on the assigned monitors within each airshed. And using those scaling factors, we can estimate people's exposures. So we have people, all the visits and all the hospitalizations have been assigned a scaling factor to estimate that person's exposure. And so as Tom showed, DEQ's greatly increased their monitor coverage. So with the monitor coverage as of 2021, we can assign monitors and scaling factors to nearly our entire study population. I think it's about 98 or 99%, which is fantastic. Previous years aren't quite as high. In 2020, we were able to assign about 91%, And you can really see, as you go back, you can see the impact of having fewer monitors. I think it's about 60% for 2018 for the hospital admissions. So we're really happy to see the coverage increasing. And then some of the planned work that's coming up soon is looking at occupational-related illness, and also, as Rick mentioned, the importance of cumulative exposure, what people are exposed to over time, both within a season and eventually over years. And this work enables us also to look at additional health conditions and comorbidities, and we're also planning to look at mortality. So this is a slide that covers some of the near real-time work that we're doing. Tom mentioned the interagency smoke calls, as we call them, where the air advisories are issued, and several state agencies and local public health jurisdictions come together to talk about smoke impacts. And both of these graphs use syndromic surveillance data, which includes a PM 2.5 feed that's from Sonoma Tech, which is the AirNow data that comes right into our Oregon Essence system. So with that system, you can see the graph on the upper left. You can combine the PM 2.5 measures. This is daily in September 2020, so 24-hour average on the bottom, and the asthma-like illness visits on the top. And you can see how closely those visits track with PM levels. The lower right just shows that you can also differentiate the emergency department visits with the urgent care facilities. And so along with that kind of information, we include demographics, mental health visits, and several other measures. So anyone interested in hearing more about that, I'm happy to talk with you later. And we're updating that template to improve risk communications and continue to target disproportionate impacts and communities across the state for this upcoming wildfire season. So thank you for your attention, and I will turn it back over to Jim to introduce the next speaker.